Hey guys, welcome to the channel. I'm a fish, and today we're going to talk about the Wuhan coronavirus, or also known as the 2019 novel coronavirus. We'll start off by looking at what actually is a coronavirus, its epidemiology, its way of transmission, and its symptoms and treatment. Afterwards, taking into perspective of the coronavirus family as a whole and novel incidents such as SARS and MERS, then we'll specifically look into what the Wuhan coronavirus is. We'll look at its mode of transmission, its symptoms, its pathophysiology, and treatment. Penultimately, we'll compare the key statistics between the Wuhan coronavirus, SARS, and MERS. And finally, we'll talk about how we can actually protect ourselves from these infections. Coronaviruses are a family of single-stranded RNA viruses that resemble a solar corona, as you can see in this electron micrograph. I actually don't know what that is. It actually looks like a really bad photo of some fireworks. But what I do know is RNA viruses mean bad news because they don't have a proofreading mechanism which allows mutation to occur and accumulate. Another notorious example of an RNA virus is the influenza virus. Mutations for the hemagglutinin and neuraminidase antigens accumulate to the extent that an antigenic shift occurs, which means a new subtype of influenza virus is formed. That is why a different vaccine for them comes out seasonally, as the influenza virus keeps changing. The HA can be thought of as a hat, and NA as a shirt, and this virus keeps changing them like a Barbie doll. Now back to coronaviruses, it actually has four main genera: the alpha coronavirus, beta, gamma, and delta. Alpha and beta both descend from bat gene pools, and whereas gamma and delta are from birds and pigs. So often birds and bats are the natural reservoirs for these coronaviruses. Zoonotic transmission, which is from animal to human, is not a common characteristic for most of the coronaviruses, but is for the novel ones, such as SARS, MERS, and now the Wuhan one. In fact, there are only 7 strains of human coronaviruses. The human coronavirus 229e-NL63 as alpha coronaviruses, human coronavirus OC43, HKU1, SARS, and MERS as beta coronaviruses. The Wuhan one has yet to be categorized. Zoonotic transmissions can be direct transmission to humans or indirect via an intermediate host, so eradicating the natural reservoir during public health measures can be very tricky. Human coronaviruses are observed to have more cases in the winter and summer. Its highest rates are among children less than 2 years of age. The infection sequence is actually important because, for example, being infected by OC43 could elicit immunity in the future for HKU1. Mode of transmission would be through droplets from respiratory outlets like a cough or a sneeze. The saliva droplet would end up on someone else's mucous membrane, like the mouth, for example, and this would possibly cause disease. These coronaviruses may survive on inanimate surfaces or fomite, so that means we gotta wash our hands and use alcohol, use soap, and airborne transmission is possible, hence why some public health officials encourage the use of N95 face masks. Symptoms of coronaviruses are often mistaken for a common cold due to the similar symptoms of fever, cough, sore throat, or nasal obstruction. So it is mostly an upper respiratory tract infection and only occasionally lower respiratory tract. And supposedly it's much more milder compared to influenza or adenovirus. However, this is not the case for the novel ones, such as SARS, MERS, and now the Wuhan one. These cause severe respiratory illness with a pretty high mortality rate. The typical SARS clinical presentation was fever, malaise, and non-productive cough, followed by an atypical pneumonia, which involves extrapulmonary features, which means there are happenings outside of the lung as well, with rapid respiratory deterioration. Diarrhea and lymphopenia, which is a low white blood cell count, were also features. And turns out that symptoms were actually milder in children than in adults. MERS was actually predominantly seen in adults with underlying comorbidities, like underlying other issues as well. So the typical clinical presentation would also be a fever, cough, and subsequent pneumonia with rapid deterioration over several days. Severe complication would include renal failure, acute respiratory distress syndrome. Gastrointestinal systems are also commonly reported, along with lymphopenia, which is very similar to SARS. Currently, there are no cures for coronaviruses, and only symptomatic treatments are performed. So now that we know how normal coronaviruses behave, we'll now look into more depth on the 2019 novel coronavirus. The current situation is about 99% of the cases are contained in Hubei, China, though now 31 provinces in China have reported cases of this virus. Around 100 cases across 20 countries worldwide have confirmed the case of this virus. This definitely speaks to the infectious capabilities of this virus. 210 deaths have been reported, and they're often seen in elderly patients who had other comorbidities. The animal reservoir is still unknown, so it's very hard to eradicate the original source of this problem. The exact mode of transmission is still unknown, but it's presumably droplet, and airborne precautions have also been alerted. The symptoms are fever, fatigue, unproductive cough, dyspnea, which is shortness of breath, and lymphopenia, which is low white blood cell count. It is less common for patients to have productive cough, GI symptoms like diarrhea, and headache, which is very dissimilar to patients who had SARS or MERS. Subsequently, pneumonia, which is inflammation of the lungs, will follow, and this was identified through abnormal bilateral ground glass imaging through CT scan. So evidently, patients with the Wuhan coronavirus will have less prominent upper respiratory tract infection symptoms like sneezing and intestinal problems like diarrhea compared to SARS and MERS. Known complications include acute respiratory distress syndrome, acute cardiac injury, and secondary infections. Ground glass opacity is a hallmark for pneumonia, and the pathophysiology comes from a cytokine storm that is triggered by this coronavirus, and this will lead to an exaggerated inflammation response. This damages the blood vessel and endothelial lining of the cells inside the lung, and this causes them to be more permeable and a little damaged. As a result, the exudate, which is fluid and cells, leak into these air spaces, hence leading to consolidation that generates the ground glass opacity seen in the images. This cytokine storm pathophysiology is also noted in SARS and MERS patients, although different pro-inflammatory cytokines were identified, but some were the same. An elevated and inappropriate T helper cell 1 and T helper cell 2 cell secretion, which are very important cells in our adaptive immune system, possibly due to the cytokines, have also been found, and this differs from SARS pathophysiology. This is about all we know so far. Unfortunately, like other coronaviruses, there is no cure nor there is a vaccine for it so far. So public health prevention and control measures are key. It is important to note that corticosteroids to reverse the inflammation and lopinavir and ritonavir, which are HIV medications, were actually used to treat SARS patients. So currently there's an RCT underway to determine the efficacy of lopinavir and ritonavir used for the novel coronavirus. Here are the key statistics between the Wuhan coronavirus, SARS, and MERS. The incubation period is very similar, but the contagious period for the novel virus is during the incubation period. This means that patients can asymptomatically infect others. The infection rate is the highest among these novel viruses, as in such a short time, the number of cases have already surpassed the number of those two other novel viruses. However, the fatality rate is much lower. To protect ourselves from this virus, we got to wash our hands frequently. Alcohol-based hand rubs are actually its weakness. Another weakness of his is hot water at a temperature of 57 degrees or greater. Make sure to wear a face mask when you go out, especially to crowded areas. Don't touch your face before you wash your hands to prevent hand-to-mouth or to eye transmission. And if you do feel unwell, please actively seek out medical attention. You'll be in great hands. Please take care, everybody.